Welcome to Deep Dive Ortho, the show dedicated to cutting through the noise and delivering the most vital, high-quality insights straight from the heart of orthopedic research.
Glad to be here.
For every orthopedic professional, the daily challenge is real. A tidal wave of new research, countless journals, conferences,
It's immense.
and the constant pressure to stay at the absolute cutting edge. It often feels like you need a full-time research team just to keep up, on top of your demanding clinical schedule.
That's right.
It's a marathon just to keep pace, isn't it?
It really is.
But what if there was a meticulously curated guide to the absolute essentials? A pathway to quickly access the landmark studies that truly shape our practice?
That would certainly be helpful.
Today, we're taking a deep dive into precisely that. The highly anticipated book, 50 Studies Every Orthopedic Surgeon Should Know.
A very timely publication.
This isn't just another textbook. It's poised to become an indispensable tool for everyone in orthopedics, from those navigating the complexities of their training
Yes, trainees especially.
to the most established consultants. Our mission today is to unpack why this specific compilation is not just valuable, but truly indispensable, providing a vital shortcut to being thoroughly well-informed and critically evidence-based in your daily practice. And to guide us through this insightful conversation, we have with us an expert in the field. Welcome.
Thank you. It's a real pleasure to be here to discuss such an important and timely resource for our specialty.
You've highlighted the immense challenge of staying current in the dynamic world of orthopedics, keeping pace with every significant study. Well, it can feel like a full-time job in itself.
It absolutely can.
The sheer volume of new research published annually across countless journals and conferences, it's staggering.
Thousands upon thousands of papers.
We're talking about thousands upon thousands of papers each year, often across highly specialized subdisciplines. So how do clinicians who are already balancing demanding surgical schedules, urgent patient care, administrative duties, how do they possibly navigate that vast ocean of knowledge
It's a huge ask.
without feeling completely overwhelmed, or worse, inadvertently falling behind on critical advancements? What are the practical realities of this knowledge gap?
It's an absolutely pressing issue and one that grows exponentially. The practical difficulties for busy orthopedic professionals in systematically reviewing foundational research are immense.
Just finding the time must be impossible sometimes.
Exactly. Imagine a surgeon who is an exceptional technical operator in the theater, brilliant hands. But if they aren't regularly engaging with the core literature, their practice over time can become less refined,
Right.
less aligned with the very latest evidence. They simply don't have the hours in the day to sift through, critically appraise, and synthesize thousands of papers to identify the truly pivotal ones.
The game changers.
Precisely. The ones that have genuinely reshaped our understanding and our practical approaches to patient care. This leads to what we call a translational gap or knowledge gap, where cutting-edge, impactful research struggles to consistently and efficiently reach the frontline clinician in a digestible and actionable format.
So it gets stuck in the journals, essentially.
To some extent, yes, or it takes far too long to filter through. And this is precisely where 50 Studies Every Orthopedic Surgeon Should Know steps in.
Okay.
The book directly addresses this formidable challenge by essentially doing the heavy lifting for the busy professional.
Right.
Its stated goal is clear and compelling: to simplify, consolidate, and reinforce the current literature. Think of it as having decades of essential orthopedic research meticulously filtered.
Distilled down.
Exactly, distilled into a one accessible volume. The core purpose, then, transcends mere information sharing. It's about disseminating findings from high-quality studies.
High quality being the key there.
Absolutely, that have led to standardized clinical guidelines for frontline clinicians and real-world gains for patients. For instance, imagine a landmark study that definitively showed a superior surgical approach for a particular complex fracture, leading to significantly lower rates of non-union or reoperation. This book captures and presents that exact insight, making cutting-edge research immediately actionable.
So it's about improving patient outcomes and standardizing care.
Exactly. Standardizing care based on the strongest evidence available. That's the goal.
That's a powerful statement. Real-world gains for patients. So this isn't just a collection, it's a strategic distillation, an intentional effort to pull the vital signal from the overwhelming noise.
That's a very good way to put it.
How does this approach fundamentally change how orthopedic professionals engage with foundational research, moving them from merely consuming information to truly data-driven practice? What's the tangible shift it enables in their day-to-day work?
What stands out here is how it transforms knowledge acquisition. It shifts it from being a passive, often overwhelming burden,
Right, just another pile of papers to read.
precisely, into an active, empowering process.
Mm.
Before, keeping up felt like having 1,000 scattered puzzle pieces with no box lid. We were an overwhelming task.
Hmm.
This book provides the picture on the box, the border pieces, and the core framework. It turns that burden into an active process where you can quickly snap vital insights into place.
Making it manageable.
Exactly. By providing digestible, manageable, and reader-friendly content, it empowers orthopedic surgeons, practicing clinicians, trainees, students, everyone, really,
Right, across the board.
to actively engage with evidence-based clinical care.
Can you give an example of how that might work in practice?
Certainly. Consider a busy consultant preparing for a complex, perhaps revision, total hip arthroplasty.
Okay.
Instead of spending hours searching disparate databases or trying to recall half-remembered papers from years ago.
Which we all do.
We do.
That's right.
They can quickly reference a chapter in this book. That chapter might distill a landmark study comparing different prosthetic designs, maybe, or bone graft techniques, instantly providing insights into the approach with the highest success rate and lowest complication profile. This isn't about rote memorization of 50 studies.
No, it's about understanding the why.
Precisely. It's about understanding the foundational evidence that underpins the guidelines we follow and the decisions we make every single day.
So it ensures those decisions are truly led by data.
Yes, led by data and evidence. It means that choices in the clinic or the operating theater are not based on anecdote or, this is how we've always done it alone.
Which can be a powerful force.
It can indeed. But here, the decisions are explicitly supported by the highest quality evidence. This is paramount for improving patient safety, optimizing outcomes, and ensuring consistency across practice.
It speeds things up too, presumably. The adoption of better methods.
It absolutely accelerates the adoption of proven methods and fosters a culture of continuous improvement. Every clinician can feel confident that their approach is supported by the best available evidence.
That's the paradigm shift it facilitates then. A direct path from research to refined, confident clinical action.
That's exactly it.
That sounds like it could truly revolutionize how knowledge is integrated into daily practice, making evidence-based care more accessible than ever. So then what does this mean for the breadth of knowledge covered?
Good question.
Is this just about common procedures like joint replacements or fracture fixation, or does it delve into the entire spectrum of orthopedics, from pediatric deformities to intricate spinal procedures? How comprehensive is it?
Well, to connect this to the broader landscape of orthopedic practice, the book is designed to be incredibly comprehensive.
That's good to hear.
It explicitly compiles landmark studies from all subspecialties within emergency and elective trauma and orthopedic practice.
All subspecialties.
Yes, and this is crucial because orthopedics is a vast and increasingly specialized field. You have everything from PAIDs, sports injuries, arthroplasty, spine, hand, foot, and ankle.
And trauma, of course.
And, of course, acute trauma. A book that only focused on one or two areas would frankly miss the mark for a general orthopedic surgeon, or perhaps more importantly, a trainee needing that broad foundation.
Makes sense.
For example, one chapter might distill the foundational evidence for managing a challenging open tibia fracture in a trauma setting. Studies on debridement, fixation, that sort of thing.
Okay.
But then another chapter could focus on a landmark study in elective practice, perhaps comparing surgical approaches for lumbar spinal stenosis, or discussing long-term outcomes of different implant materials in total knee arthroplasty.
So a real breadth there.
Absolutely. The significance of this holistic and inclusive approach cannot be overstated. It ensures relevance across diverse areas of specialization.
So it's useful for everyone, trainees and experienced surgeons alike.
Exactly. For a junior trainee, it provides a foundational understanding across the entire curriculum, a rapid grounding in the evidence base for a huge array of conditions they'll encounter. For a seasoned general orthopedic surgeon, it offers a quick refresher or an update on areas perhaps outside their immediate subspecialty focus, ensuring they remain broadly informed.
Keeps everyone on the same page, evidence-wise.
Precisely. It ensures that regardless of your specific focus within orthopedics, the compilation contains studies pertinent to your practice. It enables a well-rounded and evidence-informed approach to patient care, no matter the presentation, be it a complex elective reconstruction or an acute, life-altering trauma.
That's vital for fostering a shared, high-quality knowledge base across the entire specialty, isn't it?
Absolutely essential.
Beyond ensuring such comprehensive coverage, the authority of these studies is paramount. You mentioned high quality before. How did the editors ensure that only the most reliable and impactful research made it into the book?
A very important point.
What was the meticulous selection process behind these studies that underpins the book's credibility? Because anyone could pick 50 studies, couldn't they?
They could, but it wouldn't have this weight. And that's a critical point, and it's what truly elevates this resource.
Well,
The meticulous selection process is what underpins the book's authority. This wasn't a subjective choice by a few editors, picking their favorites. The core information tells us that an objective selection criterion was conducted by an international consensus.
international consensus.
Yes, to identify these most influential landmark publications. This isn't a small detail. It's the bedrock of the book's credibility. The methodology was rigorous and transparent.
So what were these objective criteria?
Well, key criteria included citations per year, which acts as a pretty robust proxy for a study's long-term impact.
How often other researchers referred back to it?
Exactly. How widely it has been referenced and built upon. A study with high citations is essentially one the broader scientific community has found invaluable over time.
Makes sense. What else?
They also consider high levels of evidence, meaning they meticulously prioritize designs like randomized controlled trials, systematic reviews, meta-analyses.
The top-tier stuff.
The top tier, yes, over lower quality observational studies. For orthopedics, where we're often comparing surgical techniques or implants, these highest levels of evidence are least prone to bias and give us the most confident, actionable answers.
Right.
Clinical studies and trials were specifically sought out, ensuring the research had direct patient relevance, applied to real-world scenarios, not just lab findings.
Crucial.
And finally, available references and guidelines were taken into account, highlighting studies that have directly informed or are explicitly cited in existing national or international clinical practice guidelines.
So showing their tangible influence on standard care.
Precisely. It proves their impact.
And why is adhering to such stringent criteria so paramount?
Well, it's all about establishing unimpeachable credibility and reliability. In an era of, frankly, information overload,
Definite.
having a curated collection where every single study has met such high benchmarks is invaluable. It reinforces the book's position as an authoritative reference.
So you can trust what's in it.
You can have confidence that the information provided is genuinely high quality and impactful, reflecting the consensus of the international orthopedic community. This isn't just a list of studies. It's a validated compendium of the most important research that has demonstrably influenced our field.
Providing a trustworthy foundation for clinical decision-making.
Exactly that.
That's an incredibly rigorous methodology, and it seems the book offers far more than just a summary of findings. The structure of each chapter sounds quite detailed.
It is, yes.
It seems the editors have gone to great lengths to provide a really nuanced understanding of each study, encouraging a deeper critical engagement. Why is it so important for each chapter to include details like, say, study funding sources or conflicts of interest, even criticisms and limitations, alongside the key findings?
Well, this raises a profoundly important question about how we as clinicians should engage with research critically. It's simply not enough to merely know what a study found, is it?
No, the how and why matter too.
Absolutely. Understanding the full context, including limitations. Funding is crucial for encouraging critical thinking, questioning assumptions, and considering different viewpoints.
Because no study is perfect.
Exactly. No study is perfect. Acknowledging its flaws, be it the methodological, statistical, maybe even potential biases from funding sources or author conflicts of interest, allows you to apply the findings judiciously, with appropriate caution.
So if a study on a new implant was funded by the manufacturer,
It doesn't automatically invalidate the findings, not at all, but it prompts you to critically appraise the methodology and conclusions with a heightened awareness of potential influences. You might look for independent corroboration, for instance.
right, it adds a layer of critical assessment.
It does. This level of transparency fosters a truly discerning, evidence-based clinician. This nuanced approach is vital for true evidence-based practice, which isn't about blindly following a guideline,
No.
but about understanding the evidence that informs it and then wisely adapting it to individual patient circumstances.
And it also includes results from associated studies.
Yes, and that's also very important. It provides a broader perspective. A landmark study rarely exists in a vacuum, does it?
True.
Other research might support, contradict, or elaborate on its findings. By presenting these associated studies, the book helps you contextualize the landmark study within the larger body of knowledge.
Giving a more complete picture.
A more complete and balanced understanding of the evidence landscape for a particular topic. It prevents an overly narrow interpretation of results and promotes a holistic view of the science.
Could you give an example of that?
Sure. A chapter might feature a landmark study on conservative versus surgical management of Achilles tendon ruptures, for instance.
Okay.
But then it might also reference subsequent studies that identified specific patient subgroups, maybe younger, more active patients, for whom one approach might be definitively superior.
Adding that clinical nuance.
Precisely. And perhaps most practically and innovatively, each chapter concludes with a case study.
Oh, that sounds useful.
It's an incredibly valuable feature for a book aimed at practitioners. It gives readers the opportunity to conceptualize the key findings in practice.
Bringing it to life.
Exactly. Reinforcing that, as we often say, knowledge is most valuable when understood and applied. It bridges that gap between theory and real-world clinical reasoning.
So how would that work?
Well, say a chapter covers a specific surgical technique for patellar instability. It might conclude with a case of a young athlete presenting with recurrent dislocations.
Right.
The case study then walks you through how the insights from the landmark study, perhaps comparing MPFL reconstruction to other techniques, guided the diagnosis, the nuanced decision-making for the treatment plan, and the anticipated outcomes for that specific patient.
So it really aids clinical reasoning for real-world scenarios.
Directly. It transforms abstract research into tangible improvements in patient care by showing you exactly how it applies. It's a powerful way to solidify understanding and encourage immediate application.
A book of this caliber, with such meticulous structure and critical depth, must be built on formidable expertise. It's not just the studies, but the minds that curated and presented them.
Absolutely. The editorial team is key.
Could you shed some light on the accomplished individuals who shaped this invaluable collection? Starting with the chief editor.
Yes, what's truly impressive here is the caliber and diverse expertise. The chief editor, Kapil Shugand, Ph.D., brings a unique and highly relevant blend of academic and clinical acumen.
He's a trainee himself, isn't he?
He is currently a trauma and orthopedic specialist trainee in London, which means he's right there, actively engaged in the daily realities of clinical practice.
So he knows what's needed on the ground.
Exactly. This intimate understanding ensures the book's content is directly relevant. Critically, he earned his Ph.D. in trauma simulation.
Simulation, that's interesting.
It is. This background isn't merely academic. It suggests a deep understanding of how to structure information for practical application, for surgical training, how to convey complex procedural information effectively.
Right, making it learnable.
Yes. And his plethora of work has been featured in international media, conferences, and journals, indicating significant recognition.
Yeah.
Furthermore, this is his 5th book as chief editor.
5th? Wow.
Which speaks volumes about his extensive experience and proven ability in compiling and editing high-quality medical texts, a testament to his editorial rigor.
And he has other interests, too.
Yes, beyond his direct orthopedic and editorial work, it's notable that he has founded and chairs 2 organizations aiming to reduce the education gap and promote careers in STEM.
A passion for education, then.
Clearly. And that passion is reflected in the book's accessible, practical, and highly structured approach. His unique blend of simulation expertise, active clinical practice, and dedication to learning undoubtedly shaped the book.
Making it user-friendly and clinically relevant.
Exactly. The kind of holistic leadership you want for a compilation like this.
And the other editor, Hani Abdul-Jabbar.
Yes. Hani Abdul-Jabbar, MBBS. His extensive clinical training and impressive career ensure the book's content is deeply rooted in current, real-world practice.
Trained at Imperial.
Graduated from Imperial College School of Medicine in 2004, a highly respected institution. He completed his orthopedic training on the London Northwest Thames rotation.
A very competitive rotation.
Widely regarded as one of the UK's most competitive and comprehensive. So immense exposure to complex cases, leading-edge techniques. He further honed his skills with a lower limb fellowship at Guy's Hospital Hip Unit.
Specializing in hips.
Yes, a high-volume, often complex area.
And he has international experience, too.
He does. His international recognition is notable. awarded the prestigious British Orthopaedic Association, BOA, traveling fellowship to Toronto, Canada, and a visiting fellowship to Pretoria, South Africa.
Broadening his perspective.
Exactly. Seeking out diverse clinical experiences, learning from global leaders. He also holds the fellowship of the Royal College of Surgeons of England, a hallmark of surgical excellence.
And he's involved in education.
Yes, and this is particularly relevant. His interest in postgraduate education and his role as an honorary senior lecturer at Imperial College highlight his dedication to teaching and mentoring.
So he understands the learning needs.
Precisely. Ensuring the content is not only academically rigorous, but also profoundly relevant to current clinical practice and the specific learning needs of everyone in the specialty. From trainees to experienced consultants, his insights would have been critical.
And crucially, an expert illustrator as well, Konstantinos Doudolakis, MSc, who himself is a senior trauma and orthopedic fellow at Imperial College London.
Yes, that's a brilliant touch.
That must add a vital visual dimension. In a field as inherently visual as orthopedics anatomy, biomechanics, surgical techniques, clear illustrations can make all the difference, can't they?
It absolutely can, and it's a game changer for a medical text of this kind. The inclusion of an expert illustrator like Konstantinos Doudolakis is critical.
Especially one who is also a surgeon.
That's the ingenious part. He's not just any illustrator. He's a senior trauma and orthopedic fellow at Imperial College London himself. He possesses an intrinsic, first-hand understanding of the subject matter.
So he knows what needs illustrating clearly.
Precisely. He knows exactly which anatomical relationships, which subtle pathological processes, or which intricate surgical steps are most challenging to convey through text alone and benefit immensely from clear, precise visuals.
The power of visual communication shouldn't be underestimated.
Absolutely not. Orthopedic concepts often involve complex 3D anatomy, intricate biomechanics, detailed procedures, incredibly difficult to convey only with words.
Explaining a complex fracture pattern, for instance.
Or the precise orientation of an osteotomy. Kind of benefits tremendously from a clear, accurate diagram. High-quality illustrations enhance comprehension and retention significantly.
They can simplify things quickly.
They can simplify a complicated surgical approach, clarify anatomical landmarks for safe dissection, illustrate a mechanism of injury. A well-placed, accurate diagram can be worth 1,000 words, especially for a busy clinician or trainee.
Making learning more efficient.
Far more efficient and effective. And his contribution ensures the visuals are not just aesthetically pleasing, but clinically accurate and highly relevant, truly augmenting the learning experience.
So putting it all together, this isn't just an academic exercise, is it? It's about tangible improvements in patient care, directly informing decisions on the front line.
That's the core aim.
Whether that's in a fast-paced trauma bay, a busy outpatient clinic, or during complex elective surgery. How does this compilation truly translate high-level research into actionable insights for the practitioner, genuinely transforming their daily work?
Well, when we connect this to the bigger picture of daily practice, the book is designed to directly and significantly enhance clinical decision-making.
How so?
By distilling those high-quality studies into clear, concise, immediately applicable insights, it directly leads to standardized clinical guidelines and real-world gains for patients.
The ultimate aim of evidence-based medicine.
Exactly. Ensuring the best available research is consistently applied to improve patient outcomes.
Can you walk through a scenario?
Certainly. Imagine a surgeon evaluating a patient with a challenging non-union of a long bone fracture.
Okay, a difficult case.
Yes. This book could quickly provide access to a landmark study demonstrating the efficacy of a particular biological augmentation technique, maybe, or a specific plate and screw construct shown to have superior union rates in similar complex cases.
So faster access to the best evidence for that specific problem.
Right. Allowing the surgeon to make a more informed, evidence-backed decision that could directly improve the patient's recovery, potentially preventing further surgeries or prolonged disability.
Or for a more junior doctor.
Or consider an orthopedic registrar facing an uncommon pediatric fracture pattern in the emergency department, instead of scrambling for information.
Which can happen under pressure.
Absolutely. They could quickly consult the book to understand the established evidence for its management, potentially averting complications by applying the optimal treatment pathway right from the outset.
So, more consistent, predictable, better results for patients.
That's the goal. Furthermore, the book acts as a remarkable time-saving tool.
Ah, the efficiency factor.
Which is an invaluable benefit for busy mid-senior professionals. We know surgeons are constantly pressed for time, They don't have the luxury of sifting through vast amounts of fragmented information.
No, definitely not.
This book allows them to quickly absorb critical insights without that laborious process of individual literature searches and appraisals. It's like having a highly efficient research assistant.
Who's done the legwork already?
Exactly. Who has already identified, appraised, and summarized the most impactful studies. This efficiency frees up precious time, allowing clinicians to focus more on direct patient care, communications, surgical planning,
While still staying evidence-based.
while still ensuring their practice remains robustly evidence-based and up-to-date. This also enhances confidence when explaining treatment options to patients, knowing your recommendations are built on the strongest evidence.
And it helps with ongoing professional development, too.
Absolutely. It plays a crucial role in facilitating continuous professional development. In a rapidly evolving field like orthopedics, staying at the forefront isn't optional.
It's essential for revalidation, competence.
Professional imperative, personal mastery. The book ensures surgeons remain at the cutting edge and can confidently apply the latest insights. It helps prepare for board exams, navigate appraisals,
Or just feel more confident day to day.
or simply feel confident their approach aligns with the most current understanding. It reinforces lifelong learning, providing a structured, accessible pathway to maintaining and advancing one's knowledge base.
Which translates directly into better clinical practice.
More confident, more competent, and ultimately more impactful clinical practice. Yes.
Now, it's fascinating that this orthopedic deep dive is part of a much larger series, 50 studies every doctor should know,
Yes, that's quite significant.
encompassing 18 books across various medical specialties. What does that signify about the underlying philosophy and the consistent quality you'd expect? It suggests a unified vision, doesn't it?
It really does. What's compelling here is precisely that. Being part of this broader series, 50 studies every doctor should know, signals a very clear and consistent standard of excellence and a unified philosophy.
So the same rigorous approach across the board.
It indicates a consistent methodology is at play, not just for orthopedics, but for all 18 books. You can expect the same rigorous, objective selection criteria, that emphasis on high-level evidence, critical appraisal of funding, limitations, the inclusion of case studies
Right, across different specialties.
across all the different specialties. This consistency reinforces the credibility and systematic approach of the orthopedic volume. It's not an isolated effort, but part of a well-established, proven framework for knowledge synthesis applied across the medical spectrum,
A commitment to quality and consistency.
which is rare in such a broad publication endeavor, frankly.
And what are the implications of that for future learning?
Well, this has significant implications. Such a structured approach provides a foundational model for evidence synthesis across medicine. It demonstrates a reliable template for how to effectively identify, condense, and disseminate critical research findings that tangibly impact clinical practice.
So, a potential go-to resource across medicine.
Potentially, yes. For healthcare professionals working across disciplines or just interested in other areas, it suggests the series could be that resource. Knowing the quality, rigor, and user-friendly approach are consistent, regardless of the area.
An efficient and trustworthy way to stay informed.
Exactly. It indicates a sustainable and effective model for continuous medical education and knowledge transfer in the long term. This systematic approach speaks volumes about the dedication to making the vast world of medical research accessible and actionable for every clinician.
Ensuring vital insights don't get lost.
Precisely. Don't get lost in the sheer volume of publications.
What truly stands out from our deep dive today is how 50 studies every orthopedic surgeon should know distills immense, complex knowledge into a truly accessible and actionable format.
It really does achieve that.
It's not just a collection of papers, it's a meticulously curated guide designed to promote critical thinking, ensure robust, evidence-based decision-making, and offer direct clinical application.
In both emergency and elective settings.
In both emergency and elective orthopedic practice, this makes it an invaluable asset for anyone committed to excellence in orthopedics, providing a clear, confident path through that ever-expanding research landscape.
A very useful tool indeed.
If you found this deep dive valuable, please do take a moment to rate and share Deep Dive Ortho with your colleagues. Your support truly helps us continue to bring you these essential insights. As we wrap up, consider this. How might proactively engaging with landmark studies, like those found in this book, not only refine your clinical decisions today, but also empower you to be a part of shaping the very future of orthopedic innovation? What new questions might this foundational knowledge inspire you to ask, and what new solutions might you then pursue?
Indeed. That's a key point. The enduring importance of integrating the highest quality evidence into clinical practice cannot be overstated.
Hmm.
This book serves as a powerful reminder of the continuous pursuit of knowledge required to advance patient care. And it underscores that staying informed with high-quality research isn't just about competence.
It's more than that.
It's about contributing to the ongoing evolution of orthopedics itself, fostering a culture of informed innovation.
A profound thought to end on, truly. Thank you so much for guiding us through this incredibly insightful deep dive today.
My pleasure entirely. Thank you for having me.
And thank you, our listener, for joining us on Deep Dive Ortho. We look forward to exploring more essential topics with you next time.